Hey, Tomas here. Welcome to the next video in the Clinic Success Academy. By the end of this video, you're going to know the 3 different things patients usually mean when they say it's too expensive, and the single diagnostic question you can ask to find out which one is fired. So let's get into it. So 2 things to hold before we get into the script itself. First, every patient who showed up chose to be there. They submitted a form, they picked up the phone, or walked into the door. They raised their hand. So when a patient says it's too expensive, that's not a closed door and you don't need to panic. It's a signal that something else broke earlier in the conversation. Interest is still there, the clarity just isn't. Secondly, and this is the most important objection handling principle in this whole academy, return an objection with a question. Never answer an objection with a statement. Answer it with another question. The question reveals what the patient is actually saying behind the surface words. A statement closes the conversation. Question will back it up, it will open it back up. Those 2 things are the whole game for this video. Write them down if you need to. Rewatch that last few seconds if you have to. So here are the 3 variations of it's too expensive. Before we get to the diagnostic question, I want to give you some pattern recognition because it's too expensive doesn't always arrive in those exact words. Your team will hear it as it's more than what I was thinking, or I need to speak to my partner first. That's a big one. Let me check my finances, or I wasn't planning on it costing that much, or can we do it in installments? It's different words but the same underlying concern. Once you recognize that these are all the same objection wearing different coats, you stop treating them as each one as a separate problem to solve. You have one play, and that play is a question. Here's why return it with a question works so well for this specific objection, as well as any other. Because it's too expensive is almost always one of 3 things, and they require completely different responses. So the question isn't just good manners, it's also a diagnostic tool, like an MRI. So 1, they don't yet see the value. The value stack from earlier video, step 3, was thin. They heard that what the treatment is and how it works, but they never connected it to their own specific outcome. It's a treatment sitting in the air, not a solution attached to their life. 2, they haven't connected the dots to their own results. They know what you're selling in general terms, but they haven't imagined themselves in the outcome. Not specifically anyway. No sister's wedding, no 30-year reunion, no knee that finally lets them run again. That picture's fuzzy. And then 3 is real world friction. A partner needs to weigh in. This month's timing is genuinely wrong, or finances are stretched in a way that's real. But again, these are 3 completely different problems that require 3 completely different responses. But you can't know which one you're dealing with until you've asked. So the diagnostic question you're probably wondering is simple. Totally fair. So I can help you think about this properly. Is it the amount itself, or is it confidence in the result are making you pause? Slow down on that question. Say it clearly and friendly. Then stop talking. Because here's what the question does. It splits the diagnosis clearly. If they say it's the amount, you're in category 3. Real friction, treat it accordingly. Explore timing, financing options, or phase plan. If they say I'm not sure how it'll work, or I'm just not certain, you're in category 1 or 2, a value gap. That's a completely different conversation. The mechanism behind this is simple. Patients believe, again, what comes out of their mouth more than what comes out of yours. This is why it is so important to really flesh out the discovery phase. You really want them to feel the pain of where they're at today versus the dream of where they're at tomorrow. This is what's called gap selling. So when they name the real concern themselves, they've done the diagnostic work for you. Now you can serve back to what they actually said, not what you've assumed. This is why, again, we do the discovery. You can call back what they said. Now, a really big one, and you may have even heard me say this before, is what's called the cost of inaction question. When you've diagnosed as a value gap, not a real friction issue, one of the most powerful follow-up questions that we suggest in the Academy is, what's it costing you to keep this issue another year? What's the cost of you doing nothing about this? And that question reframes price from an outflow to an investment. And it works because most patients have never done that calculation out loud. For aesthetics, a patient who has been bothered by her skin for 3 years has already paid 3 years of avoidance, low confidence, and small daily frustrations. That next year is going to be more the same. For a dentist patient who's been putting off an implant, bone loss, shifting teeth, embarrassment in photos. For a knee patient in a RegenMed clinic, another year of modified movement, potentially causing other downstream injuries in other parts of the body, skip runs, weight gain, lack of confidence, disrupted sleep. The math will always be there. The cost is for you to help the patient see it in their own words, not push them to a yes, but help them make an informed decision. One final principle, and you need to remember this, and it needs to be non-negotiable. Even when the objection handling goes perfectly, you need to lock in the next step before the call or conversation ends. Not, we'll send you a link. Not, give us a ring when you're ready. In the conversation, while you're talking, say, let's get you in for Tuesday or Thursday, or Wednesday or Thursday, or Friday, or Monday or Friday. Which works better? book a meeting from the meeting. I mentioned this before, it's so key. The single biggest leak in consultation to cash flow or consultation to treatment conversion is the gap between I'm interested and the next calendar slot. Don't leave that gap. You've done all this hard work. Biggest thing is to just be confident with the close. Close it while you're still in the conversation. So we'll recap what we've covered today. Number one, the patient opted in, be it to an ad, database reactivation, call from SEO, referral, whatever it is. Remember that too expensive is a signal. It's not a rejection. That's when it really starts. Secondly, return every objection with a question, never a statement. Three variations, 3 underlying causes, and the diagnostic question that tells you which one is fired. Try and remember right now, pen and paper, what that question is. Fourthly, for value gap cases, look at the cost of inaction question, because this reframes a price as an investment. And fifth, no matter what, always push to book a meeting from a meeting, always. How you can implement this today: write this question on an index card and put it where you handle price conversations. Is the amount itself, or is the confidence in the result that's giving you pause? And again, I'll mention, as a client of ours, please always do calls through Patient Flow. It's what allows us to review the calls, and you can see how sales and marketing is intertwined here, because if it is the case where there's not enough confidence, we may need to adjust the marketing assets or adjust the nurture messages or send out other content to people beforehand, tweak the video content we're making, or it could be a sales change. What we're doing here when it comes to growing your practice, it's like diagnosing somebody with a health problem, basically. We need to identify what specific constraint in your business needs to be adjusted. Again, like an MRI, but we need the data. So use it verbatim on the next price objection. Is it confidence in the result, or is the price? The exact wording matters. It gives the patient 2 clear paths and gets you the diagnostic information that you need. As always, team drill, 10 minutes, really easy. One person will play a patient who has just said it's too expensive. The other has to respond only with a question. Again, this is to be done by whoever is going to be talking to new leads or clients or patients. One person says it's too expensive, the other has to respond only with a question. Not an explanation, not a reframe, not a number, a question. Run it 3 times. One for each of the 3 underlying causes: the value gap, outcome disconnect, or real friction. After each round, the patient will give a 30-second debrief. With that, then you'll be able to say the patient, the question worked because of XYZ, or it didn't land because of XYZ. 10 minutes total, video it, drop it into Slack, and we'll give some feedback so we can work through one of the most common objections that we see front desk dealing with every single day. And once you've mastered this, it's another tweak that will hugely improve your bottom line, allow you to serve more patients, and ultimately make a bigger impact with your practice. I'll see you in the next video.